Doctor, just one thing what I wanted to be emphasize here कि the medical sciences is a very productive subject. UPSC never want to criticize any questions. I'm just telling about कि if you don't know the answer, how can write the answer by using the language of the question. The medical subject is very easy. आपको आता है, it like your 10-year questions and you can reproduce, you can give more time toward the other subject like the essay and ethics.
So hello, good afternoon everyone. I am Yashvardhan Singh, and in this year CSE 2025 I got rank 212, and previously also I was recommended in year 2022 and 2023. So today we are going to discuss the paper 2 of the CSE 2025 medical science optional. And to discuss the clinical approach, I have one of my senior who also has been recently selected as an assistant professor in the Lady Hardinge Medical College. So the basic purpose of this discussion would be to have a clinical insight that what is actually required to be answered in the question, because sometimes as an undergraduate student, we miss the clinical insights into the questions. So into the basic discussions, we will look that what are the insights that a clinician requires that should be written, and how we can improve our answers in the medical science optional. So we will take one question after other and we will discuss how it can be framed in better way and how it can be improved. So the first question of the year 2025 was related to laparoscopic surgery. Laparoscopic surgery is mentioned as a keyword in the surgery. So the basic question that was asked was related to that enumerate the advantages as well as the limitations of the laparoscopic surgery. This is basically a question that is asked in our professional examination as well as in our vivas, that where we have to explain the limitation as well as the advantage of this laparoscopic surgery. So I will request sir to give the insight that what will be required to be answered in this question. Sir completed his Masters of Surgery in General Surgery in the year 2022 and has been practicing from last 4 years. So what are the clinical insights, sir, that will be needed in this question?
Doctor, just one thing what I wanted to be emphasize here कि the medical sciences is a very productive subject. Why? Because in 5 year you are reading medical sciences, and from the last 10 year, what I have seen in the questions, they are mostly comes from the basic questions that is required, and you have completed through your curriculum, and it is very basic question. But the important thing is that you have to be understand what the demand of the questions. First, there is a limitation of the word. Second thing, the appropriate selection of the word, and all the things you can get from your basic books. So now we're just focusing in this question, the laparoscopic, enumerate the advantages as well as the limitation of the laparoscopic surgeries. So first of all, the people, what the limitations or what the drawback of the students, they are going toward the laparoscopic surgery. So first you will start with the introduction. Can I will get a
Yes, yes.
So when you are going toward the question, so first you have to write the introduction part. The introduction part. In introduction part, you just write one or two line that the technology have been evolved from the open surgery to the laparoscopic surgery. The both are surgery is the demand of the time as per the need of the situation. You can't write that the laparoscopic surgery is better than the open surgery. UPSC never want to criticize any questions. So you will start the surgical skill evolved from open surgeries to laparoscopic surgeries, and both are important as per the demand and situation. So this introduction will complete that open surgery is also important and laparoscopic surgery is also important. Both have advantages and disadvantages. Now, this introduction will cover the limitation as well advantage of laparoscopic. That is, open surgery has also have some advantages, and laparoscopic surgery also have some advantages, and both have the disadvantages. So in this way, you have just clear. You can mark that this is the important. Now, this is the introduction. After doing the introduction, you can write the definition of the laparoscopy. The second is the definition. One thing is very important. Till the discussion, at the time of discussion, I am not telling anything important or rocket science toward the answer. I am just telling about if you don't know the answer, how can write the answer? By using the language of the question. So language of the question is the limitation and advantage of the laparoscopic surgery. But when you are giving the advantage or disadvantage of any new technique, you have to be compared with the previous technique. And you also give the significance of the previous as well as the new technique. So now we write the definition. It is a laparoscopic surgery. Laparoscopic surgery. If मैं स्टूडेंट से एक चीज और कहना चाहूंगा कि व्हेन यू use this word and you wanted to give more fascinating or getting more number, then use the origin of the word कि laparoscopy कहाँ से है, lapros and scopy जो लैटिन वर्ड है जिनकी ओरिजिन है, अगर आप उसको डाल सकते हैं आंसर में तो इट विल गिव यू एक्स्ट्रा मार्क, because most of the people who are checking your copy from the a very big institute like the KGMC, MMC or AIMS, or the people who are writing checking your copy, they want something extra from your side.
The basic understanding is that we should never forget the basic. If the question is related to laparoscopic surgery, if we could define that, what is laparoscopic surgery?
Yes.
This is what sir is trying to focus.
So that is very important, and it is coming from the lapros and scopy. स्कोपी मतलब देखना, लेप्रो मतलब आप एक किसी इंस्ट्रूमेंट के थ्रू आप एब्डोमेन को देख रहे हैं या किसी भी चीज को देख रहे हैं, तो इट इज लेप्रोस्कोपी है. तो इट इज अ काइंड ऑफ, इट इज अ टाइप ऑफ. अब नाउ दिस गिव यू वन मोर एडेड नंबर, मिनिमल इन्वेजिव सर्जरी. मिनिमल इन्वेजिव सर्जरी. What the minimal invasive surgery? When in open surgeries, you give a long incision and open the abdomen or any other organs. But by using this technique, you are giving only few minute incision and do the surgery. So this word is very important, because maybe in further next 2 to 3 years, one more question can be asked related to this, because we are doing robotic surgery also. So it may become in future. So you have to be knowledge that what is the subcategory of the laparoscopy. Laparoscopy come under the minimal invasive surgeries. So that's important. Ki definition, second point is the definition is very important. So we have to point out the two things. First, the introduction. Introduction, if any new technique, then please correlate or compare with the old technique like the open surgery, and never give less value to the previous surgery. They have also significant, because we have told you after doing this surgery, because one line which is very important, every big surgeon in this now era write one thing that is important before doing. ये आप मार्क कर सकते हैं, before doing laparoscopic surgery. Why I am telling this? This is very important. Before doing laparoscopic surgery, you should know. आप किसी भी बड़े सर्जन के पास जाइए, वो ये लाइन जरूर बोलेगा, यू शुड नो ओपन सर्जरी. दिस इज द
And so
disadvantage.
this can be our conclusion for this question.
हाँ,
Because
this
we can
can be
conclude
used
this
as
question
conclusion.
as a
Yes,
conclusion.
कि before doing laparoscopic surgery, you should know open surgery. Why? Because if you are struggling in laparoscopic surgery, if you are mugging in laparoscopic surgery, then you have to open, and then you can't say I am only know the laparoscopic surgery, I can't do the open surgery. And this also give the significance to the open surgeries.
Like no one is superior, no one is inferior.
Yes.
It is ultimately we have to decide what is in the best interest of the patient.
And this is the thing of the middle path. कि आप किसी को ऊपर नहीं बोल सकते, किसी को नीचे नहीं बोल सकते, दोनों के अपने इंपॉर्टेंस है। जहां पर आएगा सुई का काम सुई करेगी, तलवार का तलवार काम करेगी, तलवार को सुई से रिप्लेस नहीं कर सकते। तो आपका कॉपी चेक जरूर आपका ऑप्शनल वाला कर रहा है, लेकिन उसका माइंड सेटअप यूपीएससी वाला होना चाहिए कि आप किसी को डिमोरलाइज नहीं करेंगे। तो दिस इज अ कंक्लूजन पॉइंट। नाउ व्हाट आई एम टेलिंग, टू थिंग्स, वन इंट्रोडक्शन, सेकेंड डिफिनीशन, और लास्ट का कंक्लूजन। अब हम बॉडी पर आते हैं, जो जहां से हमारी सर्जरी शुरू होगी। तो दिस इज अ वे टू हाउ टू राइट द, हमने पहला पॉइंट डिफिनीशन बोल दिया, सेकंड बोल दिया, लास्ट बोल दिया। अब हम बीच का पॉइंट की बात करते हैं, जो एज अ मेडिकल स्टूडेंट आपको लिखना है। So now I am coming toward the core and technical world of the laparoscopic surgery, the advantage and limitation. So first you are going toward the direct toward the question, advantage of laparoscopic surgeries. आप यहाँ पे पॉइंट वाइज भी लिख सकते हैं, आप पैराग्राफ भी यूज कर सकते हैं, बट पॉइंट वाइज में टीचर्स को भी सहूलियत होती है, आपको भी होती है, तो आपको ज्यादा मार्क्स मिल सकते हैं। तो नाउ वी आर गोइंग टू द पॉइंट वाइज। नंबर वन, it is a type of minimal invasive surgery. This is very important, always point this technical word. It is a type of minimal invasive technique. We are doing surgery by giving minimum incision to the body. तो फर्स्ट एडवांटेज इज मिनिमल इन्वेजिव सर्जरी। सो अब इसके सब ग्रुप आप यहाँ पे बना सकते हैं। सो मिनिमल इन्सीजन, इफ देयर इज ए मिनिमल इन्सीजन, आप कोरिलेट करिए मिनिमल स्कार,
फास्ट हीलिंग।
मिनिमल स्कार का एक मतलब हो सकता है कॉस्मेटिक
आउटकम्स,
कॉस्मेटिक आउटकम, खासकर वाई, although the cosmetic outcome, the beauty is generalized for everyone, is a universal, but if you specified young female, young people, women's, आप इसको अवॉइड भी करें तो ज़्यादा बेटर है, क्योंकि ये आपको स्टीरियोटाइप बनाता है। तो आप केवल एक वर्ड यूज करिए कि कॉस्मेटिक आउटकम इज गुड, मिनिमल स्कार, मिनिमल इंसिजन, फास्टर वुंड हीलिंग। If it is a faster wound healing, so hospital decrease, hospital stay, decrease morbidity. तो हमने अभी केवल एक पॉइंट को डिफाइन किया है, दैट इज ए मिनिमल इन्वेजिव सर्जरी। अगर मिनिमल इन्वेजिव सर्जरी है, देन मिनिमल इंसिजन, इफ मिनिमल इंसिजन, मिनिमल स्कार, better cosmetic output come, better cosmetic outcome, as well as the faster wound healing. Faster wound healing will cause decrease hospital stay, decrease hospital stay with decrease morbidity. Now you can correlate one thing with the, your economy. If decrease hospital stay, you can write one thing like economy. If it is decrease hospital stay, so early to routine work, less, you can say that less leave, more running economy. Your
personal economic loss as well as economic loss at the broader level will be less. This is the point that can be linked from the economic point of view.
Also, if decrease hospital stay, one thing, why the medical student only thinking about the medical things? because we are doing like a administrating part like senior resident, assistant professor, so we know कि hospital have multiple assets, more bed availability,
better utilization of existing. If one patient is discharged earlier, there will be better utilization of infrastructure.
This is also for the economy. If you write the economic outcome of the laparoscopic surgery, then the examiner will think you are not only a doctor, you are thinking like an administrator. Third thing, decrease health burden on government. I'm telling you the technical part as well as the part extra treatment. That laparoscopic technique actually is not only for the health structure, but it is for the economical growth economical growth of the society, as well as when the patient decrease decrease nosocomial or hospital aquatic infection. आपके साथ आप अस्पताल में एडमिट हैं, 2 लोग और आपके साथ जा रहे हैं, तो जो सोशल गैदरिंग है या जो चांस द प्रोबेबिलिटी टू गेट इन्फेक्शन फ्रॉम अदर सोर्सेज आल्सो डिक्रीज बाय यूजिंग वन टेक्निक. So laparoscopic technique is not only for the benefit of the individual, but it is a benefit for the society. It's a benefit for the society. The patient have early. Now one word is used. The people who are working in the ICU, one word is used: ICU psychosis or hospital psychosis. In open surgery, the long stay of the patient will increase the hospital psychosis. So this will decrease hospital and ICU psychosis only by using decreased hospital stay. So this is your socio-economic benefit. So you can write one point and I think this give you the extra mark. मेरे जैसा टीचर होगा तो देगा आपको, या जो मेरे मेंटर हैं वैसे टीचर होंगे तो आपको देंगे सोशियो इकोनॉमिक बेनिफिट ऑफ लैप्रोस्कोपिक सर्जरी. तो दिस इज, बहुत कम लोग इस पॉइंट को नोट करते हैं कि क्या आपके एक इलाज से समाज को भी प्रभाव पड़ता है, क्या आपके एक इलाज से इकोनॉमी को भी प्रभाव पड़ रहा है, या व्हेन यू बिकम ए आईएएस ऑफिसर एंड यू वांट टू टेल योर मिनिस्टर्स कि सर आई वांट अ न्यू टेक्निक इन द सोसाइटी, व्हाई ही विल गिव यू ओनली फॉर द बेनिफिट ऑफ द वन पर्सन, individual person, or for the society. So this surgery will enhance your socio-economic status as well as improvement and evolvement of the socio-economic status as well as. That's why the laparoscopic surgery is also demanding for the you can say the society.
So this was the broader point of bringing sir into a discussion, because all of us know 5 point what are the 5 limitations and what are the 5 advantages. We can talk about advantage. In limitation, we can talk about that it is difficult to control the bleeding, tactile stimulation is lost. We all know technical point. It is all over the notes and all over the books. But what the basic purpose of bringing sir into discussion was that what are the other points that we miss and that can be brought into a discussion. So certain these are the point at the socioeconomic level, at the individual level, hospital psychosis, ICU psychosis, nosocomial infection, how they are indirectly related. So that was the purpose, that how we can make this answers better. That was the whole purpose. And I think that this question we have discussed in a bit detail. Maybe further we will have a shorter discussion or we will make new videos for these discussions. But this was the whole purpose of bringing him into this discussion, to have a newer perspectives.
Yeah, that's a definite thing, because when you write an answer writing, most of the people we are from the medical background. Most of the people only write the medical things of the things. But when you read the Harrison or you read the Love and Valley Resorts, then they will say it's not treatment, it's a management.
Yes.
आप अपनी किताब को पढ़िए, स्टैंडर्ड बुक में मैनेजमेंट वर्ड आता है. मैनेजमेंट वर्ड जब आप हैरिसन की गाइडलाइन पढ़ेंगे, उसमें लिखा था उसका सब हेडिंग है ट्रीटमेंट.
Yes.
मैनेजमेंट में आप प्रिवेंशन की भी बात करते हैं, जब हम अपने एसपीएम में बात करते हैं कि
Yes.
इससे प्रिवेंशन. अभी अगर कोई एक अच्छा आदमी होगा जो अब करंट अफेयर पढ़ रहा होगा, इस साल एक लाइन करंट अफेयर की, तो जो मैं लैप्रोस्कोपिक से जोड़ूंगा, एक लाइन आई है इस बार करंट अफेयर में आपके, एंड दैट इज अमर. और ये WHO और इंडियन गवर्नमेंट ने इस पे बहुत काम किया है, एंटी माइक्रोबियल रेजिस्टेंस. if you are doing the laparoscopic, what you can also write a comparison data like the open surgery and laparoscopic, more use of antibiotics,
Yes.
less use of antibiotic, लेस इंसिजन, लेस ब्रीच, लेस कंटामिनेशन. ओपन सर्जरी में 10 लोग के हाथ जा रहे हैं, यहाँ पर आपका स्टरलाइज इंस्ट्रूमेंट जा रहा है. तो व्हेन यू यूज लेस यूज ऑफ एंटीबायोटिक, this directly and indirectly supporting the Amar program of India. Now we are discussing on laparoscopic surgery, but we are giving one more chance कि why the doing the laparoscopic or minimal energy surgery, because the decreased use of the post operative antibiotic use and also pre-op antibiotic use, that we fulfill the goal of antimicrobial resistance, which is a major challenge in the health sector.
So I will also tell you that what was the origin of this idea of bringing him into discussion is that sir used to check my answer and he used to give me insight. So there was a question that was related to tuberculosis, abdominal tuberculosis. So in that answer, I wrote the answers, the treatments such as stricturoplasty, Sweden, and I also wrote that what are the treatment modalities of it. But जब मैंने वो आंसर सर को दिखाया, सर categorically told you have not written anything about the nutrition aspect. Nutrition aspect is equally important as drugs. So you need to give equal weightage to the nutrition aspect as well. So these are the aspects that we sometimes we tend to miss, that in tuberculosis treatment, nutrition aspect is equally important. So these are some of the aspects that needs to be kept in mind while answering the questions.
So before ending the session, because we have a very lack time, you have to be go, and I
No,
also
sir, we will discuss few more questions. We have times, and we can discuss. This is a bit technical questions because we have to direct. This is a 5-mark question, and we have to answer this in single page.
Okay.
So describe the different techniques of creating pneumoperitoneum during laparoscopic surgery. So here we have to talk about technicalities. That what can be the technicalities of it.
So that is important. Now this is a totally technical question.
Yes.
This is a uh, global question, holistic question, and this is a technical question. But still we use something in technical question. So that first, when the people say that ki describe the different techniques of creating pneumoperitoneum. The first is always the definition. What is pneumoperitoneum? Always go with the keyword. This is the demand of UPSC. And I think you people notice or not, but one important thing, we giving general studies. So they always know कि you know general knowledge or not. And one thing is the pneumoperitoneum. So as the medical student, I will create a two things. One is the pneumo and second is the peritoneum. The air inside the peritoneum. This is an advantage and disadvantage of laparoscopic surgery, because it gives you the space by creating the air. So the first is the definition. What is the pneumoperitoneum? Pneumoperitoneum is insufflation of the air. Most probably आप लिख सकते हैं specifically CO2 we use करते हैं, because it is a gas which is a non-inflammable, so and absorbable. So the creation of the insufflation of the air inside the peritoneum is called pneumoperitoneum. Advantage: provide sufficient space for minimal invasive surgery or laparoscopic surgery. So one thing, first I have write the definition. कि pneumoperitoneum, I have divide the word pneumo and peritoneum. Pneumo means air, peritoneum मतलब in peritoneum. The insufflation of the air, especially the carbon dioxide gas, inside the peritoneum is called pneumoperitoneum. The advantage of this technique to provide the sufficient or adequate space for doing the surgery and decreasing the iatrogenic injury. Two things. And now the your master have been getting your point. Ki your point are the two things. It provide the space and it decrease the chance of injury. Now different technique of pneumoperitoneum. So now I'm going toward the core of the question, the demand of the questions. So demand of the question is technique. Broadly, it is divided into the two subgroup. One is closed technique, second is open technique. You create pneumoperitoneum by opening the abdomen or without opening the abdomen. In closed technique, we use a needle known as Varus needle. In open technique, we use Hassan method. अब यहाँ पर एक वर्ड और आप ले सकते हैं, न्यू टेक्नोलॉजी. अगर कहीं भी नई टेक्नोलॉजी आ रही है तो आप उसको यूज कर सकते हैं. वो मैं भी आपको सेकंड पार्ट में इसके बताऊंगा. क्लोज टेक्निक में क्या करते हैं, देयर इज अ निडल which is known as a Varus needle and it have a tip. This tip have a very unique character कि this tip will go inside when the pressure is applied more. So you just create a needle in the umbilical region. I can, this is abdomen. Always draw diagram, it's very important. Mostly we give supraumbilical and it will infraumbilical incision. Give incision and that is a skin incision. This is not opening the abdomen. Give a skin incision and apply a needle and create a minute hole. After applying a needle, there is a cannula and there is a channel. In this channel, you will connect to the air insufflator and this will create pneumoperitoneum. The reason is that in this Varus medal, it is a blind process. What happens in blind process? Sometimes there is a bowel just below the skin. So drawback, it is a blind process. That is a very important, and in blind process you can injure bowel or any organ. जो भी encounter होगा वो injure हो जाएगा. For to decrease this drawback, some people use open technique. In open technique, you give incision. After giving incision, you just fold the structures. This is known as umbilicofacial line and cut it. After cutting it, you are getting, it is a very, after cutting it, you getting a space. This is the open space. What the advantage in Hassan technique? The advantage in Hassan technique, you see each and every structure and then you put the cannula here and insufflate. But the problem is that you are talking about the minimal invasive surgery and you increase the incision. The difficulty is sometimes the leak happened here because you open the abdomen, it is not elastic. So the leakage of air which called insufficient pneumoperitoneum. The surgeon may have a struggling because the air is less and space is less. So another technique is the Hassan technique. So this is a two technique on the basis of you are going the blind procedure, that is a closed, or you are doing it is a open procedure like the Hassan technique. Now most of the people will close here the discussion, but the discussion will start after it. The thing is that both the open and closed technique have some modification. modification. You are doing a surgery. You can write like the case scenario as you write in ethics, or you can simply find out previous surgery, previous lower abdomen surgery. The this make you the extra number. In previous lower abdomen surgeries, there is a dense adhesion, and if you go with the blind procedure, you can injure the intestine or any other organ. So we use Palmer method. Now this will give you the extra mark. When there is addition, and nowadays in India, LSCS is common. The patient have the bowel which can adhere there. So surgeon or the new surgeon have a problem ki if we put an incision and I can damage the, so you will go in the mid-axillary line and subcostal space, and here you make the port. This is the Palmer technique. So if you write the Palmer technique, just write a one line. If there is a massive adhesion in the lower abdomen, there is a difficulty to making the supraumbilical or infraumbilical port, we can use the Palmer technique. So this will give you one extra point. दो मैंने technology. Second चीज है, you are using the blind procedure. So there is a chance of injury. Now you can make a chart here. A simple chart which give you the more point. Blind like varus, chance of bowel injury. Open, Hassan technique, more incision, leak. And now, can you give a solution of these both problem? So now people have a very unique trocar. इसे VI trocar भी कहते हैं. This is a transparent. Because it is a transparent, you are creating a blind, but it is not a blind. Because you can see through the trocar. You can see through the trocar कि इधर bowel है. And because it is a pointed, so there is no need of the long incisions. So this is the new technique what I am telling you, the new advance या recent advance, हम लोग यहाँ इसको अपने इसमें कहते हैं recent advance. What are the recent advance? So recent advance is vision tychor या transparent trocars. So this is the things, the first key how to the create the technique of the pneumoperitoneum, what the laparoscopic technique, what the blind, what the open. In blind the modification like the Palmer's space use कर सकते हैं, and for the open technique Hassan और उनके drawback. So this will give you now the conclusions. Conclusion में आपको लिखना है pneumoperitoneum is pneumoperitoneum is a technique, or you can simply write that opens, blind and hybrid techniques are used for creating pneumoperitoneum. It can be conventional or modified. Conventional जो हम supraumbilical port डालते हैं, infraumbilical port डालते हैं. Modified like Palmer space as per the condition of the patient. We are evolving the new technique like VI trocar for creating pneumoperitoneum. So this is the conclusion कि हम conventional method भी कर रहे हैं, ये भी कर रहे हैं, and everything depends not only the patient as well as the surgeon. I am not confident to doing a blind process. So in ego, I am not forced कि नहीं मेरे को करना है. So I can use the open. So it depends on the surgeon, it depends on the patient, it depends on the condition as well as logistic. छोटा remote area का है, इकोनॉमिकली वो वेट को यूज नहीं कर सकता है, So it is a holistic. You can't say that this is the best, this is the bad. In medical science, nothing is the best, nothing is the worst. Everything depends on the scenario. So always write your conclusion and have mentioned all the things. आप सर्जन की भी कैपेबिलिटी रखिए, आप पेशेंट की भी कैपेबिलिटी रखिए, आप कन्वेंशनल मेथड भी रखिए, आप ओल्ड मेथड भी रखिए, और रिसेंट एडवांस अगर आपके पास हैं तो आप उसको भी मेंशन करेंगे.
And also, since this is a 5-mark question and we have to answer all these things in a single page, so what we can do is we can just write Hessian method, and we can draw a small diagram depicting Hessian method or Verey's method, and after that we can draw about Palmer, and after that we can draw VI Trukar. So it will be a best way. Diagrams will also be there, and also it will be summarized. The time issue will also be maintained if we are drawing 4 diagrams in that, rather than going for explanation, because diagrams by themselves are self-explanatory in this case. So we can directly grab three diagrams, 2 or 3 diagrams, and we can do the labeling of these diagrams, which will explain the process, because here we have to see describe. The word is not enumerate. It is saying we have to describe the process, the different techniques of creating pneumoperitoneum. So by describing all the techniques in words, in theory, in one page, it become a bit difficult. But if we will draw a diagram like the sir has drawn, so it will become a bit easier by we can describe it in a bit easier way.
One thing question that sometimes the people say that I am not a very good in diagrams or other things. So I just give you a few flow chart type of portion of this answer, and I think the people will like it. How can I write in my examinations? One thing, the pneumoperitoneum. Uh, Pneumoperitoneum. I will give the definition. Pneumo means air, peritoneum means in peritoneum. So insufflation of air in peritoneum. So definition will end up here. Now I will write pneumoperitoneum, blind procedure, ओपन टेक्निक. ओपन टेक्निक का नाम आपको लिखना है. हैसन टेक्निक. ब्लाइंड टेक्निक में आप यूज करते हैं वर्से निडल्स. राइट ऑफ वर्से निडल्स. वर्से निडल्स ऑफ द टिप. दिस इज अ कैनुला. दिस इज अ पोर्ट. तो यहाँ से आप एयर से इंसुफ्लेशन करते हैं. दिस इज अ फ्लेक्सिबल निडल. फ्लेक्सिबल निडल. ठीक है. द ब्लाइंड यू कैन पुट इट हेयर. Only give incision, skin incision. Then give varus needle. Then connect to the air. Pneumo peritoneum. एक चीज और लिख सकते हैं, clinically judged by surgeon. Then use trocar. So this is your open technique. Now the closed technique. This is umbilicus. You put one incision here, one incision here. There is a gap. Hold, cut the fascia. Open the abdomen. Examine the examine की जगह पे you can use open the abdomen, check the visibilities, put the trocar. Now create the new peritoneum. So this is a diagram. The master can be see, and it will take less time. Then after doing this is blind process, this is open process. Advantage, advantage, disadvantage, disadvantage. New technique and modification. So in this way, up to down, the master will find out the everything, and it is a holistic, as you say, and it is easy for us because I am such a thing that open technique जैसा कि फेशिया कट कर दिया, यहाँ पे फेशिया नहीं कट किया है, यहाँ पर ये एडवांटेज है, डिसएडवांटेज है, and I will give you the full mark as per the demand.
So also in the next few minutes, we will take this question is also related to surgery. We will take a question related to peritonitis. This was also asked. And this question related to anal fissure. The surgical conditions of anal canal is a topic that is mentioned in the surgery. So there has been certain question related to anal fissulas. And but anal fissure was not that much repeated questions. And as far as I remember, it was asked for the first time. We will discuss one more question related to
One thing what I want to do there, although this is a few new question in this time, but anorectal anorectal is very important. When you are giving the exam, the UPSC, one thing is you have to be mentions that they think like a bureaucrat. Nowadays, because of the lifestyle modification, the people have digestive problems like constipation, ulcerative colitis, and Crohn disease. And when these problems will increase, then there is a disease which increase the incidence of the anorectal nowadays. That's why in previous year they will asking the due classification of the colorectal malignancy. In this year, colorectal they will saw the anal fissure, hemorrhoid. These are the topic you वो पूछें या नहीं पूछें आपको जाना है. एज अ सर्जन मेरे से कोई पूछेगा कि जनरल पेपर बनाओ, मैं एनोरेक्टल पूछूंगा ही पूछूंगा. Is a favorite topic, breast is a favorite topic, thyroid is a favorite topic, shock is a favorite topic. So this is the question is very important. You never think that कि ये नहीं आ रहा तो नहीं पूछा जाएगा. You just go one reading from this, and that is very easy topic. And what I am saying कि now the lifestyle modification, they are the question.
Etiology.
Why they are the question? The lifestyle modification, because the constipation have a very big role for the anal fissure. And this can be managed by the improving lifestyle modification. I am a surgeon. I write one thing in the anal fissure or hemorrhoid cases: fluid, fiber, and fitness. Triple F. मैंने एक भी इंसिजन नहीं लगाया, मैंने कोई सर्जरी नहीं की, बट एज ए सर्जन आई राइट वन थिंग्स, क्योंकि यही इटियोलॉजी है. आप फ्लूइड सही से नहीं ले रहे हैं, आप फाइबर रिच डाइट नहीं खा रहे हैं, आप फिटनेस नहीं कर रहे हैं. एंड बिकॉज आई नो इकोनॉमी, फाइबर रिच डाइट is come from the mota anaj, that is the millets. If you are promoting this program, you promoting millet program of India. So this is the integration. You can think what the psychology of the teacher, why he is giving the questions, what the current issues is going on. वो minimal invasive कर रहे हैं. I am definitely sure in the 3 to 4 year the question come from the robotic surgery. So just we go toward the question. And one thing is very important what I am saying, the medical subject is very easy. आपको आता है, it like your 10-year questions, and you can reproduce, you can give more time toward the other subject like the essay and ethics. So just to how to correlate, take it simple. And for any exam what I faced or you faced or anyone faced, extra नहीं करना है.
So the basic strategy is how to deconstruct the syllabus, because
Yes.
in syllabus it is mentioned the surgical conditions of anorectal region or anal canal or the rectal region or the colorectal region. So we have to deconstruct that in the anal canal there are three most clinically cases. One is that of anal fissure, another is that of fistula, and another is that of hemorrhoids.
Yes.
And in rectum, the most common is that is
Colorectal
asked is that of colorectal cancer.
Yes.
Colorectal cancer was asked last year.
Last year.
Last year they asked colorectal cancer, and this year they have anal fissure.
Anal fissure.
And in the anal fistula also they have asked about the Parkes classification in
Parkes.
the earlier years.
Yes.
So the Duke classification, although we study colorectal carcinoma, Duke classification is a very important classification that is used in the colorectal cancer. So last year there was a direct question related to a Duke's classification.
And we have discussed it just
We
before
have
one day
discussed- we have
before the
discussed it.
exam.
We discussed it that Duke classification is very important for the colorectal carcinoma cases. So if we will have we have discussed these questions in detail. We will have a brief overview of the other questions, and in the coming time also we will come through other sessions also where we can discuss all the questions probably in detail if the sir have with the permission of sir. So we will discuss other questions related to surgery that were asked in CSE 2025. See, in the first paper discussion, I was telling you that question number 5 is compulsory, and in section 2 we have to choose other question, but question number 1 and question number 5 is compulsory. So if you see how the questions are set up, first question 20 mark, that is of surgery. Second question is that of obstetrics and gynecology related to MMR. Third question is related, this is also related to pelvic endometriosis. This is also related to OBS. Other is related to SPM. So clearly it means that we cannot skip any syllabus, any subtopic of the syllabus or any subject. Like we cannot skip SPM or we cannot skip surgery, because questions in the compulsory sections are being asked from each and every subject. Similarly, we see question number 6. First question, hypertensive disorder in pregnancy related to OBG. eclampsia complications, types of
High-risk
eclampsia.
pregnancy, high-risk pregnancy.
Management of see, sir was focusing on, when we talk about management, we have not to focus only on the treatment aspect. We have to focus on the preventive aspect of it as well, and other different aspect of it. So if they are asking management, we have to focus on all the wide varieties, all the subcomponents of the management. So the next question is that of clinical feature and management of ulcerative colitis. The surgical
देखिए,
ulcerative
this
colitis.
question will anorectal पूछा उन्होंने, and now they will asking of the ulcerative colitis. So ulcerative colitis, Crohn's disease, they can't. This is a very unique topic.
Remember, what is unique about this question is that although ulcerative colitis is mentioned in the syllabus, Crohn's disease is not mentioned in the syllabus. But whenever we study ulcerative colitis, we study in parallel with the Crohn's disease. We compare what are the differences between ulcerative colitis and Crohn's disease. So although Crohn's disease is not mentioned in the syllabus, ulcerative colitis is mentioned as a keyword in syllabus. They have asked the difference between ulcerative colitis and Crohn's disease, because this is the standard questions in pathology as well as in surgery. So we have to judge from the point of view of syllabus. If ulcerative colitis is mentioned in the syllabus, its comparison with the Crohn's disease can also be asked, and this has been asked in this year's CSE 2025.
The one thing is that because this is a part of diagnosis.
Yes, sir. Differential diagnosis.
The
also.
presentation is clinical presentation is symptoms are same, little bit differentiate, but the symptom the both the patient come with a pain, abdomen, alter bowel habit. But when you are making the diagnosis, and diagnosis are going to be different, and treatment is also going to be different. So if you don't know how to correlate the symptoms, the closely related diseases who are similar presentations, and that's the beauty of the UPSC, they will ask both the questions. You have that boundary of your diagnostic and clinical scenario, and if you don't are able to make the diagnosis, then how can you treat it? That's why they are asking it.
And also, as I was telling you, that question OBG, second question. Second question of surgery, third question of SPM. So it means again that questions are set up in such a way that we cannot skip any subject. Now, the seventh question. Describe the clinical features and diagnostic workup of a suspected case of peritonitis. Enumerate the principle of management of peritonitis, enlist the important complications of peritonitis. So if we compare this question with our professional examination, this is a long question of our professional examination where they just ask about peritonitis and where we have to write everything that we know about peritonitis. This is also a similar question, but subheadings and sub questions, sub parts have been provided in it. First, we have to write about clinical features, diagnostic workup, and enumerate the principle of management, important complication of peritonitis.
Oh, so, Doctor, one thing what I wanted to told you, this is the proper way of a long questions answer body. One, yes, feature and diagnosis, management and complication.
Also, if in any question these headings are not given, we have to
write
give these headings. We have to write our answer under these headings, starting from clinical features. Then we can move to diagnostic workup, management and complication.
And this is the psychology of the UPSC. UPSC आपको आंसर इसी तरीके से चाहता है. अगर वो इन चीज़ों को नहीं दे रहा है, you have to must write these word in your answer writing, and you can go to your Harrison. They will write like epidemiology, etiopathogenesis, then management में वो treatment, psychological वो सब चीज़ें देते हैं, complication and then conclusion. तो जस्ट ट्राइंग टू गिव योर आंसर इन सच हेडिंग. अब दो पॉइंट भी लिखेंगे ना, मास्टर यही चाहता है. जब तक आप एमबीबीएस करते हो आपको नहीं पता होता, पता क्या एपिडेमिक्स के क्या करेंगे, कि इंसिडेंस कितना है, प्रेवलेंस कितना है. बट व्हेन यू आर इन द सेक्टर, व्हेन यू आर सर्विस प्रोवाइडर, देन यू हैव टू नो कि यार ये डिसीज इतनी इंसिडेंस की है, तो इसकी हेल्थ प्रॉब्लम इतने हैं, तो इस पर पॉलिसी ज़्यादा बनानी है. क्या ये डिसीज इराडिकेट कर सकते हैं, क्या इसे कंट्रोल प्रोग्राम कर सकते हैं, तो हमको उस पर. तो अगर आपको किसी भी क्वेश्चन में कोई कंट्रोल प्रोग्राम आ रहा है, कोई स्कीम आ रहा है, तो यू हैव टू मेंशन इट and it will give you the further extra marks.
So moving to the last question, that is question number 8. See, the national framework for malaria elimination has been asked. 27, 23 respectively. And if we see the surgery question related to it, it was that of cleft palate. Cleft palate is part of syllabus, it has been mentioned, but it has not been asked very frequently. But this year they have asked specifically question related to. And if we see, we study cleft palate. So embryogenesis is the basic part of explaining cleft palate, because when we are explaining cleft palate, we have to explain the embryogenesis. So here also they've given the heading embryogenesis, clinical features and principles of management of cleft palate. When we study also, we study cleft palate under this subheading only, that what are the embryological origin of this condition, what are the clinical features and principles of management. And also, as sir was telling repeatedly, principle of management of cleft palate, because in cleft palate we have to, first is the surgical treatment, we have to take care of surgery. Yes. Cosmetic aspect is second. Also there are certain issue of hearing related management, because yes, that connection that exists, so there might be repeated ear infection, so we have to treat repeated ear infection. And also breastfeeding is very difficult in a patient who is suffering from cleft palate, so we have to answer that. What are the principles of management of cleft palate?
So awareness, जो एक वर्ड यूपीएससी बार बार पूछता है, अवेयरनेस प्रोग्राम, जैसे स्माइल ट्रेन चला, yes, तो यू हैव टू मेंशन स्माइल ट्रेन या गवर्नमेंट ऑफ इंडिया का, क्योंकि दिस इज नॉट अ प्रॉब्लम ऑफ ओनली द चाइल्ड,
Yes.
because child have the emotional attachment with the parents. This is also a psychological pressure on the parents, and it is a psychological challenge as well as the physical challenge to the individual. मैं अच्छा नहीं दिख रहा हूँ, लोग मुझे सोशली आइसोलेट कर रहे हैं, मैं और भी प्रॉब्लम देख रहा हूँ, तो
साइकोलॉजिकल इश्यूज फेस बाय
हाँ,
चाइल्ड।
तो इसके लिए अगर आप वे फॉरवर्ड देना चाहते हैं तो प्रोग्राम ऑफ अवेयरनेस को जरूर लिखें, कि जब लोगों को पता चले कि हाँ ये ट्रीटेबल है, लोग सोचते नहीं ट्रीटेबल है, so it is a treatable. And second thing which is beauty of this question, why I love this question, because this question explains कि यूपीएससी आपसे क्या चाहता है. क्लेफ्ट पैलेट इज ए कंजेनाइटल डिसीज. कंजेनाइटल डिसीज तभी हुआ होगा जब आपका ऑर्गेनोजेनेसिस क्या हुआ होगा, अफेक्ट हुआ होगा. मतलब जब भी कोई कंजेनाइटल डिसीज वो आपसे पूछे, जैसे उसने पूछ लिया बच्चों में एआरएम, एनोरेक्टल मालफॉर्मेशन इज वेरी कॉमन, या कोई भी कंजेनाइटल एनोमलीज अगर हो रही है, तो वो कंजेनाइटल एनोमली तभी हो सकती है जबकि एम्ब्रियोजेनेसिस में कोई मालफॉर्मेशन हुआ. तो व्हेन दे आस्क और नॉट आस्क any congenital anomaly, and if you know the embryogenesis, always write embryogenesis. इसलिए उन्होंने इस क्वेश्चन को, बाकी जो पहले का क्वेश्चन था जैसे अल्सरेटिव कोलाइटिस हमने देखा, अल्सरेटिव कोलाइटिस में दे विल आस्क फ्रॉम द क्लिनिकल डायग्नोसिस, they go to the management, but what the different in this question, so you should know what the demand of the question, कि if you have any congenital abnormality, always go with the embryogenesis. तो आपके पास कोई भी आए, वन थिंग ऑलवेज इंपॉर्टेंट, द सर्जन लव एनाटॉमी मोर देन सर्जरी. तो व्हेन एवर यू राइट अ सर्जिकल क्वेश्चन, इफ यू हैव एनाटॉमी, प्लीज ड्रा द इमेज. कोई जरूरी नहीं कि आप एकदम वैसे ही बनाएं, अगर आप कर्व करके भी बना रहे हैं और मेंशन कर रहे हैं कि ये एंटीरियर या पोस्टीरियर है, द मास्टर विल सफिशिएंट टू अंडरस्टैंड, बिकॉज ही नो अबाउट द डेप्थ ऑफ द नॉलेज. ही जस्ट to want to know that you know this is anterior posterior or not. So always draw what is message from my side, and also what you were saying in the previous question explanation. One, flow chart. अगर आपका क्वेश्चन फ्लो चार्ट में आ रहा है बहुत अच्छा. सेकेंड इज डायग्राम. इंट्रोडक्शन साइंटिफिक एंड कंक्लूजन साइंटिफिक. अगर कोई स्कीम आपको आती है जो आपने करंट अफेयर की तैयारी करते थे, जैसे मैंने अमर बोल दिया, या कोई स्कीम है या हेल्थ बर्डन पे बोल दिया, या अगर आप मेडिसिन के क्वेश्चन लिख रहे हैं, आजकल हम इन्फेक्शियस डिसीज से ज़्यादा हम मेटाबॉलिक डिसीज की तरफ जा रहे हैं, तो इस समय जैसे कि हार्ट के ऊपर उन बहुत काम कर रही है, डायबिटीज के ऊपर गवर्नमेंट बहुत काम कर रही है. तो अगर आपके पेपर में आप एक कॉपी बनाइए जस्ट फॉर द मेंस, आप एक कॉपी बनाइए, उस कॉपी में आप देखिए कि आपके सिलेबस के कौन कौन से टॉपिक हैं. आप जब पेपर के थ्रू जा रहे हैं, इसमें हेल्थ सेक्टर पढ़ रहे हैं, कोई भी लाइन आती है बस उसकी हेडिंग लिख दीजिए. एट द एंड यू हैव 10 पेजेस ऑफ डिफरेंट हेडिंग्स, and try to use these newspaper cuttings as a conclusion or as a introduction of your question. देन मास्टर को लगेगा कि हाँ यार ये तो हुआ था, ये तो हमने सोचा नहीं, सरकार भी इसके बारे में सोच रही है, तो वो आपको और ज़्यादा नंबर देगी, क्योंकि एक डॉक्टर को ये लगता है ना कि अगर आप एडमिनिस्ट्रेशन की तरफ जा रहे हैं तो क्या आप एडमिनिस्ट्रेटिव की तरह सोच भी रहे हैं, and it will give you the reflect more answer. तो always point out, this is a message from my side, कि जब भी आप करंट अफेयर पढ़ें और अगर आप मेडिकल साइंस को एज ए सब्जेक्ट ले रहे हैं, जैसे कभी कभी आप पढ़ते होंगे कि आयरन डिफिशिएंसी एनीमिया पर कोई
We can integrate our general
हाँ
examples as well.
एग्जाम्पल्स है कि आयरन डिफिशिएंसी एनीमिया में हर 3-4 हफ्ते में एक ना एक पॉइंट आ जाता है। ये आपने देखा होगा कि कितने बार इन्होंने केवल हाई रिस्क प्रेगनेंसी, एनीमिया और इसी पे क्वेश्चन पूछा है। और आपके जितने भी गवर्नमेंट स्कीम है उसी पे आ रही हैं। आप लिख दीजिए कि प्रधानमंत्री मोदी हैव बीन टोल्ड इन दिस, आप प्रधानमंत्री मोदी का नाम नहीं लेना चाहते, केवल पीएम लिख दीजिए, पीएम एड्रेस दिस प्रॉब्लम दिस एंड दिस प्रोग्राम इज लॉन्च इन दिस ईयर, तो they can give you extra mark. If I am examiner, I will give you extra mark, and I think my mentor जो मेरे कॉलेज के लोग हैं या जो हैं, they will also give the extra mark, क्योंकि जब भी हमारे ओरिएंटेशन होते हैं, जब भी हमारी सीएमई होती है, तो वो जानते हैं डॉक्टर को मैनेजमेंट आता है, डॉक्टर को क्या नहीं आ रहा कि गवर्नमेंट कहाँ से आपको हेल्प कर रही है।
So this was the basic purpose of discussions, and we will be coming up with the other discussions as well, where we will try to understand what are the difficulties being faced in the medical science optional. And I have faced certain difficulties, and I will try that the certain difficulties with the help of guidance of seniors like sir, these difficulties are sorted out. So this was one such overview kind of discussion. In future, we will also come with certain other sessions as well. So that's all for this session. Thank you very much.